Good day everyone, we continue to discuss enteric pathogens and enterobacteria. In current lecture we'll talk about Yersinia. So it is as well gram-negative rod-shaped bacteria, facultative anaerobic, non-fastidious, and Yersinia is a small, like a cocobacilli, non-sporin and non-encapsulated microorganism. So motility is variable option in that microorganism, mainly in current lecture we discuss only enteric pathogens as Yersinia pseudotuberculosis and Yersinia enterocolitica. Both are non-motile in human body temperature, but about 36 or 37 degrees. But in environmental samples, if you take some aquatic or other samples, bacteria will be motile. Yersinia is a zoonotic agent, means that initially it's observed in animals and human became accidentally infected with that pathogen. It is distributed worldwide, and if you will apply not gram stain, if you will apply some giemsa stain or methylene blue staining techniques, bacteria appeared as a bipolar staining. Two ends of rods are stained in blue color and center appear transparent. It resembles some safety pin shape or some unique appearance it have. Again, as any other enterobacteria, initially Yersinia should be cultivated on McConkie agar, and in the case of Yersinia, you will obtain pinpoint small colonies, lactose negative, but colony itself will be stained in red pigment. It is due to production of pigment by Yersinia. It's not due to utilization of lactose, and mainly colonies are transparent and agar around colonies is not changed. Selective culture media for any Yersinia, including enteric pathogens, it is CI and agar. It allows to inhibit other bacteria, and Yersinia growing on CI and agar will resemble some bull's eye appearance. It is a red center surrounded by white zone around, and resembles like a bull of eye of angry bull. If you talk about viral infectors of Yersinia enterocolitica, it is as well lipopolysaccharide or O antigen, the same functions as in previous bacteria. Yersinia enterocolitica have number of adhesins and fimbria which are required for fixation to epithelial cells of human intestine. It can produce unique enzyme which is known as invasin, as it obvious from the name. That enzyme helps or allows bacteria to penetrate in intestinal epithelium. It is a protein which is located on the surface of the membrane. Bacteria can produce enterotoxin, which is known as YST toxin. It is a stable molecule which acts on cGMP in the host cells and epithelium of intestine, leading to abnormal exchange of water and electrolytes and manifest with diarrhea. As well, bacteria have number of secretory systems. Two most important are T3S and T6S. They are cytotoxin by activity. They help bacteria to resist complement activity, to resist white blood cells, and can lead to apoptosis of host cells. It means that premature death will be observed. So, according to different properties, bacteria is classified into biotypes and into serotypes. According to biochemical and physical-chemical properties, bacteria is classified into 6 biotypes, 1A, 1B, and 2 to 5. And according to structure of O antigen, more than 57 serogroups are identified, and only few of them are most frequent in clinical practice. But again, it is important in epidemiological purposes, but in clinical manifestations, all bacteria will cause the same disorder. So the most frequent pathology caused by Yersinia enterocolitica is, again, it obvious from the name, it is enterocolitis. Bacteria is transmitted by some contact with animals, rodents or cattle, aquatic reservoirs, and some birds can transmit disease to human. Again, usually human became infected accidentally, and disease is transmitted by raw food or undercooked food, sometimes through contaminated water or milk. Disease can have several manifestations. It can manifest as an abscess, as terminal ileitis, or acute enterocolitis. But almost always it manifests by watery diarrhea, maybe with the blood in stool, and sometimes, especially in younger kids, it can resemble appendicitis and require differential diagnosis with that surgical pathology. In severe cases, in young infants, when immunity is very, very low and flora is absent, few cases of necrotizing enterocolitis were described, but again, it is an exception. Very rarely that complication can be observed. In general, pathogenesis of disease resembles shigellosis. Again, invasion through M cells acute, macrophages are involved, and bacteria replicates in epithelium, invades pair patches, disseminate to mesenteric lymph nodes, and lymphadenopathy in pairs patches can be observed. Rarely, bacteria can disseminate to liver and spleen with formation of abscesses. In usual way, disease is limited to intestine only. In some cases, secondary manifestations were described after convalescence from diarrhea. Some erythema nodules appeared in the skin, or polyarthritis was observed. Some cases of heart involved, but again, it is rare. Main number of diseases are limited to intestine and require only symptomatic therapy. Antibiotics are not needed if disease is limited to GIT. Diarrhea is self-limited. In few days, human will recover without any consequences. But again, if you see that disease is prolonged, if some systemic complications or extraintestinal complications appeared, then of course antibiotics required, and Yersinia enterocolitica required combination therapy. Several antibiotics should be prescribed. Specific prophylaxis is absent. Only proper sanitation, washing hands and other is required to prevent the disease. Few rare complications of Yersinia enterocolitica infection. It is erythema, appearance of red patches on the skin. And second bacteria is Yersinia pseudotuberculosis. Again, it is enterobacteria, and all factors of pathogenicity are applied. Some additional absent in other Yersinia factors. It is YPM exotoxin. It is superantigen toxin, again causes non-specific proliferation of T cells, release of massive cytokines. It can lead to splenomegaly. Bacteria have number of systems for regulation of intracellular survival in macrophages, proteins of outer membrane which are important in surveillance of bacteria in intestinal cells, resistant to phagocytosis as well, and it can non-specifically inhibit chemotaxis of neutrophils and immune cells. And bacteria have additional antigen which is known as V antigen. It required for regulation of transport systems, have anti-inflammatory activity. So by that property, Yersinia pseudotuberculosis resembles Yersinia pestis. We will discuss that later. It is causative agent of plague, and some attempts to use Yersinia pseudotuberculosis as a vaccine strain to prevent plague were described in scientific papers. So Yersinia enterocolitica as well classified according to structure of O antigen in 15 serogroups and 21 serotype. And according to recent genetic studies, it was classified into 6 genetic groups, named group 1, group 6. It's again not really important in medical practice because all diseases, doesn't matter about the structure, are the same. Clinical manifestations of pseudotuberculosis are much more difficult and a lot of different clinical forms described. The key idea that bacteria can multiply in pairs patches but then invade into the bloodstream and induce bacteremia. With the flow of the blood, bacteria will spread to different organs, multiple organs and tissues, and in those tissues specific pathogenic lesions will be formed. It is granulomatous lesions with coagulative necrosis, and by that damage, bacteria resembles tuberculosis. Formations of almost the same lesions in organs including lungs, and easy to be confused with tuberculosis. That's why bacteria get that name. Again, clinical manifestations will be very different according to which organ and tissue is affected. In classic way, it is acute GIT disorder. Again, it can simulate appendicitis, and lymph nodes, mesenteric lymph nodes are affected. If lungs are affected, then it can be symptoms like TB, low-grade fever, constant cough without any pus in sputum. If lymph nodes of spleen or liver is affected, then it can have another symptoms, some abdominal pain and other. Again, rarely, but some cases were described when Yersinia pseudotuberculosis gave rise to severe systemic infection with multiple organ failure, and mortality rate is very high. Especially patients and subjects with underlying disorders such as hepatic cirrhosis are affected by that bacteria and systemic manifestation of the infection. In the case of tuberculosis, joints are the most frequently affected organ, and a lot of different types of arthritis were described. It is the most serious complication, especially when spinal cord involved. Different regions, spinal cord of the thoracic cavity or joints near the pelvis, but it is deforming spondylitis or deforming arthritis. When motility is affected, painful movements, and it can lead to serious consequences, formation of abnormal position of spinal cord. So usually pseudotuberculosis is self-limited disease, but again, if you see that disease spread more than just an intestine, then antimicrobial treatment is required, and usually drug of choice is fluoroquinolone, any of the group. And again, specific prevention is absent. The only thing we can do is handle the food correctly, try to keep hygienic level high, washing hands, good food, cooking, and other processes. So very few words we can say about Yersinia. It is a rare pathogen. So that's all for current lecture. Bye bye. Thank you.